So today we'll look at how to examine lump and bump. So let's say you've been presented with lump. This is an example for mannequin. So the first thing is start with inspection. Okay, so what do you inspect? Remember 6S. So of course start with number, whether it's solitary or multinodular. Okay, then you look for site, size, site. Describe where is it. Okay, yeah, it's a proximal. Use words like proximal, distal. Okay, for example, at the distal forearm. Okay, volar aspect of the distal forearm, for example. Play along. Dorsal. Okay, palmar. Use these words. Site, size. Okay, on inspection, just give an approximate size. Shape, round, ovoid. If it's oval, say ovoid. Okay. Surface, whether it's smooth or not, or it's whether irregular. Then talk about scars, any scars which are present, any skin changes which are suggestive of inflammation, any skin ulceration. And then you want to do site-related, site-specific test. What does this mean? So for example, if you have a swelling at the back, okay, so you ask the patient to push against the wall. Then after that, you want to move to palpation. So what do you do in palpation? The first thing is, of course, you look for warmth. You look for temperature. Always temperature, use the dorsal aspect of the hand, okay, and compare to any increment in warmth. And of course, you want to confirm the size. So always use a Taylor's tape. Confirm the dimensions, horizontally and vertically. So how many centimeters by how many centimeters, and confirm. So that will be the size of the swelling. Then of course the surface. So use the palm aspect of the fingers. The surface, whether it's smooth, okay, irregular or nodular, okay, and then the margin or edge of the ulcer. So how do you palpate for the edge of the ulcer? Use the pulp of the index finger. That's how you do. So what can you look for? You can look for signs of erosion of the margin deep into the bony structures. For example, that can happen in dermoid cyst. You also want to look for a slip sign, which is there in lipoma. So what happens in slip sign? The moment you palpate the edge, the swelling moves away. What else can you comment about the margin? You can comment whether it's regular or irregular, whether it's well defined or poorly defined, and whether it is sharp or rounded. So check for the edge, okay, and then check for the consistency, whether it's hard, firm or soft. So if upon palpation, if the swelling feels like you're palpating your forehead, it is hard. If it feels like you're palpating your nasal cartilage, it is firm. If it feels like palpating your lips, it is soft. Okay. And then you want to look for fixity. Okay. Okay. Then you want to check for reducibility and compressibility. What's the difference? You basically press on the swelling. So if the swelling is reducible, the entire swelling will disappear the moment you press. Really disappear. Compressibility means the lump will partially disappear when you press, and it will completely reappear when you leave the pressure. So that's the difference between reducibility and compressibility. Then you want to also check for fluctuation. Fluctuation is a key indication that the swelling is fluid filled. So one way is stabilize the swelling with 2 digits and use 1 digit to press in the middle. So you can see whether it's fluctuant. Another method would be to use the middle finger, ring finger and index finger and ring finger to stabilize, and middle finger to check for the fluctuance. Then you want to check for fixity. What do we mean by fixity? To see if the swelling is attached to the skin. So how can we do? See if it's pinchable. So for example, here I cannot pinch the skin. It means that it is fixed to the skin. Now how do I know if the swelling is attached to the deeper layers like the muscle? So first is I want to check for mobility. So horizontal and vertically. So if the swelling is freely mobile, it is likely that it is attached to the subcutaneous tissue. If the swelling is attached to the muscle, ask the patient to contract the muscle. So upon contraction of that muscle, the swelling will not be mobile in that plane of the fibers of the muscle. Okay, so the mobility will be restricted the moment the patient contracts the muscle. And also, if the swelling is arising from the muscle or structures deeper to the muscle, the swelling will reduce in size the moment the patient contracts. And similarly, there will be restricted movement when the patient contracts the muscle. Next, you want to check for transilluminability. So you want to see if the swelling is transilluminable. Okay. So you make a funnel kind of with a paper like this, and you put it at one end and use a pen torch to shine it at the base at a different location at the swelling. So and view through the scope here and see if it actually illuminates. So this is an example of negative transillumination. If it's actually positive, it will appear like this. It will actually appear illuminated. That is transillumination. And then, not to forget, you also want to palpate for pulsation. So how do you do that? You use two fingers. So you can palpate and feel for any pulsation or thrills. If there's a palpable pulsation or thrill, you then auscultate to look for the bruit. Okay. You auscultate and look for bruit. And finally, you conclude the examination by doing regional lymph node examination according to the areas. For example, the swelling is at the abdomen, you do an inguinal lymph node examination. If it's at the cervical region, you do cervical lymph node examination. If it's at the back, you do an axillary lymph node examination. So that concludes the lump and bump examination. Thank you.